Over 7,200 Nebraskans have been tested for COVID-19 at hospitals, urgent care clinics, and drive-through clinics like this one here at Bryan Health in Lincoln. Over 6,800 of those results have come back negative, those families celebrating the diagnosis. But there is some growing concern in medical circles that some of those negative results might not be accurate.
I think it's possible that you could have up to 30% false negative rate. It's also possible it may be a bit less than that. Maybe it's 10%, maybe it's 20%. The important thing is it's probably not zero.
Bryan Health's Dr. Jim Nora was the most cautious of the three experts interviewed about the rate of false negatives. The concerns stem from a Chinese study published in a collection of preliminary medical reports. The study and its estimation of a 30% false negative rate were cited last week in a Yale doctor's New York Times editorial and an article in the Boston Globe. In Nebraska, the director of the Nebraska Public Health Lab says it's not time to throw away the test.
The answer is no. Okay. First off, the sensitivity is usually pretty good. It's probably greater than 90%. All right. When you say a negativity of 30%, I would say that it is really dependent on where the sample came from. It's dependent on the pre-analytical processing of how the sample is handled. It's also dependent on the particular assay itself.
Dr. Pete Iwin also pointed out the Chinese study hasn't been peer-reviewed and the preferred nasopharyngeal test wasn't used. There are possibilities for error, though. Dr. Iwin says mistakes could include using the wrong swab, swabbing incorrectly, improper labeling, transporting samples in the wrong temperature, and taking too long to test the sample. His lab rejects about 1% of samples because they're incorrect. Another possible false negative trigger is that patients have stopped shedding virus.
There may be only a short window of opportunity to do testing, and it may be just a few days, maybe it's 7 days, but there may be a subset of patients it's only 3 days or 5 days. We don't know at this point.
But get past the pre-analytical phase, and CHI infectious disease doctor David Quimby is confident in the results.
Information from the company puts it at 95% or greater sensitivity, which means you would have very, very few false negatives. When we did in-house testing with the known samples, our results were somewhat better than that.
The doctors all agreed if you're still showing symptoms, a negative test result shouldn't change your behavior.
Just what you should do when you have any sort of respiratory infection. Don't pass it along to other people. Stay at home, isolate yourself, good hand hygiene, good cough etiquette, those type of things.
The experts say the concerns don't apply to positive results. They haven't heard of any false positives, but apply that possible 5% false negative rate to Nebraskans, and that's more than 340 false negatives. Reporting in Lincoln, Michael Shively, News Channel, Nebraska.